Just a few weeks ago, I was at a clinic. Now, I'm not going to say where I was, but let's just say it's a place where everyone knows better and has been taught to not do this one thing. Hello, and welcome to this week's tasting flight of tips to keep you rooted in your daily practice. My name is Tina Clarke, also known as Teacher Tina RDH. I'm a dental hygienist, educator, speaker, and author. Basically, I like to share information with others. So let's dive into this week's topic. Just a few weeks ago, I was at a clinic. Now, I'm not going to say where I was, but let's just say it's a place where everyone knows better and has been taught to not do this one thing. So I observed a dentist handing an uncapped syringe to the dental assistant. Y'all, pointy end first. I can't believe that I'm actually even talking about this. It should be common sense, but, sometimes common sense doesn't always pass from clinician to clinician. And we still need some reminders. Now, we're going to take a look at some basic safety items when it comes to needle management. The first one is don't have your hand or anyone else's near the sharp, pokey end. Let me say that again. Don't put your hand near the sharp, pokey end. So what you need to do is practice uncapping the needle with only one hand. And if you have an assistant to help you with your procedures, that's totally great. But is uncapping your needle really something you need help with? If you do, have your assistant gently loosen the lid from the syringe and you can uncap it the rest of the way. So what about when you're all done? Well, my friends, use a capping device. There are several of them available, from a simple piece of cardboard with a hole in it that you can put your cap in, all the way to the large variety of sterilizable metal holders. And then there's always the good old-fashioned scoop technique, which I have to say is always a winner. Now, to avoid playing chase with the cap if you're doing the scoop technique, use your locking cotton pliers to hold the cap in place. Oh, speaking of locking pliers, do you have those on your tray? Locking pliers are one of the gold standards for our syringe slinging slayers out there. Now, if you don't have those, you can always grab your regular cotton ones too. But, not only do they come in handy for recapping and grabbing items from your drawers, but in the event of a mishap, like a needle breaking in your patient's mouth, it can be your go-to safety retriever. And this is where the Boy Scout motto, be prepared, always is great to come into action. Because, when you are prepared for an urgent situation, it either won't happen, or if it does, it won't be that big of a deal. Along with that thought, make sure you don't hub your needle. If your needle is hubbed all the way to the mucosa and the patient moves, causing the needle to break, the mucosa will spring right back over the needle, making it virtually disappear into that soft, spongy tissue. And then you have a new issue on your hands, right? A great way to avoid this from happening is using the correct needle length for the injection, and also make sure you have anywhere from 3 to 4 millimeters of needle showing from the hub. Safety during your injection is important too. Using retraction devices can help keep your fingers out of clear and present danger. However, if you're like me and you learned old school and you like to use finger retraction, make sure you create enough space between you and the injection site. A syringe stability is another key way to avoid an accidental needle stick as well. Now, once you are all done with your injection and you have safely recapped your needle, the other time to be really cautious is during the dismantling procedure. So here's a few things to keep track of as well. When you're taking the needle off of the syringe, I encourage you to hold it near the hub, where the needle and the barrel come together. So That's called the needle adapter section. I encourage you to hold it and twist the syringe to unscrew it from the two parts of each other. Again, using those pliers is a great thing to have, and it can actually hold it for you. Please do not grasp it with your hand over the cap. I have seen way too many times where the needle bends and ends up sticking out the side of the cap, or it falls off the needle, creating a potential sticking point for you, okay? Also, when dropping the needle into your sharps container, it should easily fall into that bin. So double check and make sure your container isn't past the full line, or if it happens to have one of those stockpiles where it looks like a slope of needles, one side is really high and the other side is really low. If that happens, just gently tap the side or bottom part of the sharps container to even things out. Then you can go ahead and drop your needle inside. I'm going to say this really slowly. Never use your finger or hand to push the needle into the sharps containers. Friends, several years ago, a former student of mine, she was super distracted when she was dismantling her needle, and when she placed her needle into the sharps container, the needle didn't go down all the way, and she wasn't even thinking it. She tapped it down with the tip of her finger. This caused a very deep puncture wound on her index finger. And then, to make the situation a little scarier for her and really everyone involved, the patient was actually being treated for a blood-borne pathogen as well. So talk about a stressful situation. At that point in time, the patient had already left the clinic, and so we had to give the patient a call to get some information, and I asked them to go and get tested. The student had to go get tested, and even though things turned out a-okay, she ended up having to go through all these hoops and ladders and protocols. It would have been so much easier if she would have paid attention and not used her own hand to tap it into the sharps container. And by the way, when was the last time you looked at your sharps container? Hopefully you have one in every operatory and in the sterilization area. So next time you're near one, double check to see how full it is. If it's full, close that lid and switch it out. If it is got the stockpile, see if you can level it out. All right. So this is a great task for one person in the office to oversee as well. Another thing to look at is if the container lid has its own plier/needle remover with it. There are a lot of them that have that kind of funky little top on there. So that really makes your sharps disposal easy. Remember, the needle and the glass anesthetic cartridge are what go inside the sharps container. Your rubber stopper, if that comes out, you can just put that in your regular trash. Same for any kind of the cardboard recycling recapping holders. Those can go into regular trash as well. Okay, friends, following these simple steps can keep you and your patient safe and your injections effective. Thanks for joining this week's Tasty Tip. Make sure you tune in next time for another round. In the meantime, I invite you to join me on Facebook and Instagram. You can find me by searching for Teacher Tina RDH. Or you can check out my website, www.teachertinardh.com.
Thank you, Teacher Tina, for that great advice. And remember that your sharps container is full before it reaches that fill line, which is only 3/4 of the way. And don't be silly passing the needle to each other. Uncapped, especially needle first. So important. And I'm so glad that she is sharing these things that may seem like common sense, but sometimes we forget silly things, or we just get busy or not thinking. So keep thinking. This is super important. I wanted to thank Smile Makers for sponsoring the Dental Elements podcast. They are offering you guys 20% off of your orders. So 20% off by using code DAP20. So DAP20, and go to smilemakers.com. They have lots of dental supplies. So they're not all about toys. They also have anesthetics, disposables, treatment supplies, personal protection, x-ray supplies, restorative supplies. So a lot of different things. So give them a look and place an order for 20% off. Thank you so much and have a great day. Cheers.